Hi, my name is Jim Wallace. I'm the health officer with Okanogan County Public Health and a family physician with Family Health Centers in Okanogan County. And wanted to speak a little bit to the vast amount of information that's out there about COVID. There's really good information and evolving information. We've learned so much in the past 20 months. I don't recall ever having a brand new diagnosis, brand new disease that we knew nothing about, and then less than 2 years later, having the abundance of knowledge that we do now. We started out without a whole lot of information about this new virus. We didn't have tests. We didn't know exactly how it was transmitted. Early on, I remember washing groceries, washing down counters and surfaces everywhere I went, and not realizing that the primary route of transmission was airborne transmission. We've also learned what treatments work, and we've learned what treatments are not as effective. We know that for people with severe COVID who are hospitalized, we want to do everything we can to keep them off of a ventilator and provide steroids and antiviral medications to prevent progression towards the need for ventilation. We also know that before hospitalization, providing monoclonal antibodies is a way to prevent progression of the disease that leads towards hospitalization and death. We also know what treatments don't work and what treatments have yet to be proven effective. Early on, there were stories about hydroxychloroquine providing some benefit. It's been well proven now that that's of no benefit, and actually with the side effects from hydroxychloroquine that have been well known, it's not a safe medication to use for COVID. There's a medication called ivermectin that many people would love to see have benefit. I would love for something as simple, as cheap, and is well known and universally obtained to be effective in COVID. And I've had a lot of discussions with physicians who would like to prescribe ivermectin. But if you look at the data, if you look at the reports that are out there, there's no proven benefit to using ivermectin. In fact, what I've seen and discussed with patients in the hospital is that they thought that ivermectin was helpful, and they spent a long time at home suffering from COVID taking ivermectin in hopes that they would get better. But they wound up in the hospital and had wished that they had come to the hospital sooner. So I hope that no one takes a medication that is not proven that could then delay the proven treatment that they can get through hospitalization or care with other healthcare providers. There's a lot of information out there, and there's a lot of confusing information out there. So I encourage everyone to go to the source of the information, dig deep, and if it's unclear, ask your healthcare provider. There are a lot of very knowledgeable folks in Okanogan County at all of our healthcare organizations, Three Rivers Hospital, North Valley Hospital, Mid-Valley Medical Group, Confluence, and Family Health Centers where I work, who are happy to share their knowledge with you after years and years of study of medicine and public health and how to treat illness and disease. They're specialists in that. Another very valuable source of information that we have in Okanogan County is our school nurses. They're on the front lines, and they're working hard to keep our kids safe. They're great at talking with kids, talking with families, and the public at large about what they're seeing with regards to cases of COVID, with the complications that they're seeing, how to protect our kids from COVID and prevent transmission of COVID, and what treatments are available to us. Many schools are testing, and the school nurses have great resources for getting more information when there's a question about whether to test or whether to isolate or whether to quarantine. And I work closely with them and really appreciate the work that they're doing.